Okay, we are going to be talking about the reproductive system. We're talking about the male and female reproductive system, as well as pregnancy and birth. So you've got primary sex organs, which are the testes in males and the ovaries in females. These are the organs that produce the sex cells that are called gametes, and they also secrete the sex hormones. Accessory reproductive organs include any of the ducts, glands, and external genitalia. Sex hormones for males is androgens, and females is estrogens and progesterone. Sex hormones play a very important role in the development and function of the reproductive system. So it's not just the sexual behavior and drives, but it's the growth and development of the organs and the tissues to get them ready in order to be able to create offspring, to have babies. So the male reproductive system, you've got the testes, which is where sperm is produced, and this lies within the scrotum. The sperm are produced within the seminiferous tubules, and they're delivered through a series of ducts. One of them is the epididymis. You got the ductus deferens, the ejaculatory duct, as well as the urethra. If a male were to get a vasectomy, they would cut and ligate, which means they cut the tube and then they seal it shut. The ductus deferens, which is a nearly 100% effective form of birth control. Of course, there are always exceptions if for whatever reason the ligation wasn't complete or it came apart over time. Then theoretically a sperm could get through and could possibly impregnate a girl. So it happens all the time. So it's nearly 100%, probably 99% effective. So here we see the male reproductive system. Here is the ureter and the urinary bladder here. So you can see the semical vesicle here, the ductus deferens, and it kind of comes back here behind the bladder. You've got the prostate gland, so this is what males will have checked for cancer. And then you've got the vas deferens. There is the kind of the duct here that is where the sperm will travel through. And then here you have the epididymis, the testes, and the scrotum. So semen provide a transport medium and the nutrients, such as fructose, as well as protecting and activating the sperm and helps in their movement. So the semen is the liquid in which the sperm are in. And that's needed so that because the sperm are extremely tiny and they have a very long way to go. So they need stuff to help protect them from the female reproductive system that will try to attack them, as well as energy and stuff to make that long trip. So humans have 23 pairs of homologous chromosomes, and the gametes only have 23 chromosomes and are said to be haploid. The gamete formation is by meiosis, in which the number of chromosomes is halved. So you go from 2n to n. And this is so when one gamete of a female matches up with one gamete of a female, that you have the normal amount of chromosomes and you don't have twice the amount that you should have. So, mitosis is where there is complete replication of the chromosomes. And one daughter cell is exactly like the mother cell, whereas meiosis, you have a division of the number of chromosomes. So in mitosis, you end up with a complete set of chromosomes. So you're 2n, you're diploid. Whereas the daughter cells in meiosis only have half the amounts. And again, this is so that the daughter cells, when they meet up with another daughter cell of a male and a female, the gametes meet up, that they have the normal 46 chromosomes. So if each of them came with 23, when they meet up, they would have the normal 46 that they should have. So, meiosis 2 mirrors mitosis, except that the chromosomes are not replicated before it begins. So, meiosis accomplishes two tasks. It reduces the number of chromosomes in half, and of course, we know that that's important for the production of the gametes, and it introduces genetic variability. So, there's kind of some crossing over and a little bit of shuffling. So, when that gamete meets up, it's not exactly like the parent. This is why, children don't look exactly half and half in between their parents. It's because there's a little bit of genetic shuffling going on. So you see here there was some crossover in between. So you see the purple and the green there in the picture. There's a little bit of crossover. And so that when they create a new cell, new baby there, it has a unique set of chromosomes that are not just like the parent gametes. Primary spermatocytes, so this is the production of sperm. They undergo meiosis 1, forming two haploid cells called secondary spermatocytes. Secondary spermatocytes then undergo mitosis 2, and their daughter cells become spermatids. So it's just like the production of the egg cells. You have to replicate and split those, the number of chromosomes in half. Male secondary sex characteristics include the hormones, and this is usually begin to be induced at puberty, and they induce changes to the non-reproductive organs as well as the reproductive organs. There's the appearance of pubic axillary and facial hair. Axillary is the armpits. Enhanced growth of the chest and deepening of the voice. Skin thickens and becomes oily. Bones grow and increase in density. And skeletal muscle mass increases in size and mass. And this is all due to the androgens, or the male sex hormones. The female reproductive system is includes the gametes, also called the ova. And they secrete female sex hormones, estrogen and progesterone. Their accessory ducts include the uterine tubes, the uterus and vagina. The internal genitalia is the ovaries and the internal ducts, and the external genitalia is the external sex organs. So here we see, just to kind of orient you to what you're looking at here, this is the ovaries up here, and then you have the fallopian tube. Here is the uterus, so when it's, there's no baby in it, it's pretty small, it's pretty collapsed, there's not a lot of space in there, and it's roughly the same size as your bladder. So here's the bladder right here. So they're really not that much different when there's no baby there. And then here is the cervix right here. And so during pregnancy, that's going to seal off so that it creates a nice seal so nothing is escaping the uterus during the pregnancy. Okay, so the ovaries are paired organs on each side of the uterus held in place by several ligaments. So they're not just floating around in your body. So here's the ovary right here. So it's going to release an egg. So here's a ligament that holds it in place. And you also got a mesometrium, which is some connective tissue. It's kind of holding it in place as well. And then it's going to release an egg, which is going to be picked up here and then travel down the fallopian tube where it would be fertilized. And then that would go on to implant in the uterus if that were to happen. Usually only one ovary will ovulate a month. So, 1 month the left one may ovulate, the next month the right one ovulates, and so on. Embedded in the ovarian cortex are the ovarian follicles, and these kind of make the ovary look like a chocolate chip, right? So you have each of these are little follicles that you see here, and each of them have a different state, an egg with it at a different stage of maturity in it. So eggs, an immature egg is called an oocyte. Eggs around the oocyte are called follicle cells, and they're one cell layer thick. Then you got granulosa cells when there is more than one layer present. So as these cells mature, the follicles kind of change, and then when they're completely mature, that cell, that ova, is ovulated. Ovulation is the ejection of an oocyte from a ripening follicle. So if you look here, you begin here with these very immature follicles. Okay, and you got the oocyte here, and it's surrounded by those granulosa cells, and it's continuing to mature and mature over time. And then eventually, here is a mature one, and then it is ovulated. So it's released out, and it will be picked up by the fallopian tube, where it may or may not be fertilized. And then what is left behind is kind of the remnants of that. So this is the corpus luteum is something left behind after an oocyte has been ovulated. Okay, and it's normal, and then it'll slowly be reduced over time and continue helping other eggs along the way. So when the fallopian tube receive the ovulated oocyte, and that is where inside the fallopian tube is where fertilization will happen. The uterine tubes have no contact with the ovaries themselves, and the ovulated oocyte is kind of cast into the peritoneal cavity. So they're not actually, touching. It kind of has to go across a no man's land to get to the fallopian tube. But there is cilia on the fimbriae that create currents that help the oocyte get into the uterine tube. The oocyte is carried towards the uterus by peristalsis and ciliary action. So here you see, here's the ovary, and that egg kind of has to cross this distance here, but the fimbriae, these little finger-like looking things, kind of wave and waft the egg towards it to help pick it up, and then in the fallopian tube it will be fertilized. The uterus is a hollow, thick-walled organ located in the pelvis. It is the major portion of the uterus. The body is a major portion of the uterus. The fundus is the rounded superior. So here's the fundus up here. Rounded region superior to the entrance of the uterine tubes. The isthmus is the narrow region between the body and the cervix. The cervix is a narrow neck which projects into the vagina inferiorly. The uterine wall is composed of 3 layers. You've got the perimetrium, which is the outermost layer. You've got the myometrium, which is the middle layer with a lot of muscles. So these are what contract during labor. These are what contract during menstruation when females have cramps. That's that myometrium contracting, trying to get the endometrium out, which is the inner lining of the uterus, and that's the layers of cells that will be shed during menstruation. Oogenesis is the production of female sex cells by meiosis. In the fetal period, the 2 end stem cells are split in half and then multiply by mitosis and store nutrients. There's a monthly series of events associated with the maturation of an egg. So you've got the follicular phase, which is a period of follicle growth, about the first 14 days. And this is where immature follicles are stimulated by hormones. Then you got the luteal phase, which is the period of the corpus luteum activity. And ovulation occurs in between these two. So follicular phase, the oocyte is maturing and getting ready to be ovulated. It is then ovulated, stimulated by hormones and matured and ovulated. After ovulation, you have the formation of that corpus luteum and the luteal phase. Ovulation occurs when the ovarian wall ruptures and expels the secondary oocyte. Middle schmerz is a twinge of pain, sometimes felt at ovulation, named after the person who kind of discovered that. 1 to 2% of ovulations release more than one secondary oocyte, which, if fertilized, would result in fraternal twins. After ovulation, the ruptured follicle collapses. The granulosa cells enlarge, forming the corpus luteum. If pregnancy does not occur, the corpus luteum degenerates in 10 days, leaving a scar. If pregnancy does occur, the corpus luteum produces hormones until the placenta takes over that role at about 3 months. Breast cancer usually arises from the epithelial cells of the ducts. Risk factors include early onset of menses or late menopause, no pregnancies or the first pregnancy that occurs late in life, previous history of breast cancer or family history of breast cancer, and then hereditary factors including mutations to the genes BRCA1 and BRCA2. But 70% of women with breast cancer have no known risk factors. So that is why it's important for females to always check themselves. Treatment of breast cancer: early detection by self-examination or a mammography. Treatment depends on the characteristics of the lesion. Typically, it's radiation, chemotherapy, and or surgery, followed by irradiation and chemotherapy. Today, a lumpectomy is a surgery used rather than radical mastectomy. Sexually transmitted diseases. We're going to talk about a few of them. One of them is gonorrhea, which is a bacterial infection spread by contact with the genital, anal, or pharyngeal mucosal surfaces. Symptoms in male include painful urination and discharge of pus from the penis. In female, you've got abdominal discomfort, vaginal discharge, and abnormal uterine bleeding. If left untreated, it can result in pelvic inflammatory disease, which can be very painful and even deadly. But treatment it can be easily treated with antibiotics, but resistant strains are becoming more prevalent, making it harder to treat. Syphilis is also a bacterial infection. It can infect fetuses and cause them to be stillborn or to die shortly after birth. It creates a painful chancre, appears at the site of the infection, and disappears in a few weeks. Secondary syphilis shows signs of pink skin rash, fever, and joint pain, but it also can be treated with penicillin, which is why it's important to go to the doctor if you suspect anything. Chlamydia is the most common STD in the U.S. This is also called the CLAP. It's responsible for 25 to 50% of all diagnosed cases of pelvic inflammatory disease. It includes urethritis, which is inflammation of the urethra, penile and vaginal discharges, abdominal, rectal, or testicular pain, painful intercourse, and irregular menses. Can cause arthritis and urinary tract infections in men, and can cause women to become sterile if left untreated, and can also be treated with tetracycline. Viral infections, so there's two typical types. You've got genital warts caused by the human papillomavirus, HPV. Infections increase the risk of penile, vaginal, anal, and cervical cancers. Genital herpes is caused by the Epstein-Barr virus type 2 and characterized by latent periods of flare-ups. Congenital herpes can cause malformations of the penis, and it has been implicated with cervical cancer and has to be treated with antiviral drugs like acyclovir. This slide is in the wrong spot. Okay, this slide is in the wrong spot. It should have been several slides back, but we'll go ahead and cover it anyways. So basically, only one sperm is allowed to penetrate a oocyte, or so the egg. If more than one were to penetrate, then the oocyte would not be viable, and you would probably just expel that egg, and it would never actually implant and become a fetus or anything, because there would be way too many chromosomes for it to develop. There are two mechanisms, though, that ensure monospermy. One of them is as soon as the sperm penetrates, the membrane depolarizes, and this prevents any other sperm from being able to get in. And there are also proteins which destroy the sperm receptors on the egg, so again, no more sperm can get in. and cause sperm already bound to it to detach. Okay,